We proudly present Actisound by Guided Therapy Systems, designed and manufactured by Ardent Sound. Actisound is a better alternative for your patients with chronic soft tissue injuries. Actisound works deep beneath the surface of the skin, utilizing intense therapeutic ultrasound, repairing injuries to the soft tissues such as ligaments, tendons, and muscle. Watch now as our clinician demonstrates the system.
Power button is here. The system will boot up in a few seconds. Once booted, you plug the handpiece connector into the system. The system will show the ID, the energy that's used, the amount of pulses per second, and shows that the tip is already connected and ready for use. Once you remove the tip, the screen display will show you that there's no tip available and it will not treat.
Each handpiece is used to treat a specific depth. The A4-6 lateral epicondylitis handpiece is focused at 5 to 6 millimeters below the skin line. The A3-13 plantar fasciitis handpiece is focused at 13 to 15 millimeters below the skin line.
To replace the tip, place a dot of gel on the probe and connect it. Now the system realizes that there's a tip connected. Take the ultrasonic lotion and place it on the patient's elbow, around the area of the common extensor tendon.
When treating lateral epicondylitis, the energy defaults at 1 joule per pulse and can be lowered to 0.9 or 0.8 joules per pulse. When treating plantar fasciitis, the energy can be set between 4 and 5 joules per pulse. You can set the spacing between 1 and 5 pulses per second.
The green light indicates that the handpiece is idle. This is your trigger. Place the handpiece on the elbow and move around the area of the common extensor tendon. The number of pulses is being recorded by the system.
When treating plantar fasciitis, use a looping motion along the medial and central bands of the plantar fascia from just distal to the calcaneus to the mid-arch, pausing every 100 pulses to reapply more coupling lotion and to allow the patient to rest for 15 to 20 seconds. Continue the pattern of treatment and rest until the required number of pulses is achieved. The treatment regimen ranges from 200 to 400 pulses for lateral epicondylitis and 500 to 1,000 pulses for plantar fasciitis. Treatment times are between 5 and 10 minutes, typically well tolerated by patients. There is no need for anesthetics or NSAIDs during or after treatment. Post-treatment regimen will be prescribed by the treating clinician and generally includes stretching and strength-building exercises. Patients often enjoy pain reduction as early as 72 hours and return to normal activities.